Good afternoon, everyone. Thank you for joining us on our training for vaccine and herd immunity. My name is Dr. Eva McGee, and we're so happy that you decided to join us for this training. And my student that will be presenting this training is Rohan Sadiji. And Rohan is currently a graduate student at Charles R. Drew University of Medicine and Science, where he is receiving his master's degree in biomedical sciences. He completed his undergraduate degree at the University of California, Santa Barbara, where he received a Bachelor's of Science degree in biochemistry. Rohan has also investigated research on site-directed mutagenesis and confrontational analysis, conformational analysis using molecular assimilation. And this was all done during his undergraduate studies. Rohan is the recipient of the American Chemical Society Undergraduate Award in Analytical Chemistry. And he also was awarded the Charles W. Buggs Award from Charles R. Drew University of Medicine and Science. And this award is awarded to a student with the highest GPA in the program. And upon completion of his master's degree, Rohan is pursuing the path to medical school for a future career as a medical practitioner. And Rohan graduate thesis work has been on looking at vaccine, more specifically COVID-19 vaccine, and how we can actually reach herd immunity. And one way to reach herd immunity is by providing trainings like what we are providing today, and with the hope that each and everyone will understand the importance of taking or considering vaccines, more specifically the COVID-19 vaccine. So now I am going to hand it over to Rohan.
All right, thank you very much for that kind introduction, Dr. McGee. I will now be sharing my screen for the presentation. Okay, perfect. All right, hello everyone. Thank you for coming to this presentation. I'll be going over the program today called a community training program on coronavirus vaccines hesitancy for the prevention and elimination of COVID-19, a program to help achieve herd immunity. My name is Rohan Sadegi, and my mentor is Dr. Eva McGee. Courtesy of Dr. Thomas McGee, the Academic Senate Statement President of CDU, I'll be going over this statement. As faculty of a higher learning institution that promotes health equity, wellness, and social justice, the Charles R. Drew University of Medicine and Science, CDU, Academic Senate strongly encourages all CDU faculty, students, and staff to be vaccinated against COVID-19. We have observed a strong reduction in the spread of COVID-19 in our communities due to increased vaccination uptake. Vaccines save lives. We urge the CDU family and their loved ones to follow the Academic Senate's strong example and promote vaccinations to our community, where every life is important. So known as community immunity or herd protection, herd immunity is achieved when a substantial majority of the population becomes immune to infectious disease, and this can help prevent the spread of a disease, which can be achieved in two different ways. The first being the vaccination of large populations of individuals to achieve immunity, which may require 50 to 95% of the population to be vaccinated, and the second method being populations contracting the disease and building a natural immune response to the pathogen. Herd immunity has eradicated diseases such as mumps, measles, and polio, and estimates have been made that 80 to 95% of the population must be vaccinated to reach herd immunity against COVID-19. From early January of 2020 till a year later on, there have been almost 25 million COVID-19 cases and 500,000 deaths in the United States. A record-breaking 300,000 COVID-19 cases were reported in early January, marking that date as the pinnacle of the pandemic, in which mass lockdowns were implemented as hospitals were overflowing with COVID-19 patients. For patients that were able to recover from COVID-19, some were still left with long-term effects, such as constant fatigue, chest pain, cognitive problems, and many more issues, illustrating the devastating effects of the virus. On December 11th, 2020, the first emergency use authorized vaccines for COVID-19 were approved by the FDA for healthcare personnel and long-term care facility residents. As the number of available doses increased and the administration criteria expanded, a significant reduction in daily COVID-19 cases were reported in the United States, marking the effectiveness of vaccination. Currently, over 50% of the population is vaccinated against COVID-19, and 150 million people totally have been vaccinated against COVID-19. In order to achieve herd immunity, mass vaccinations must be performed for the United States population. Currently, an average of 1.05 million doses are administered daily in the United States, which means that if herd immunity threshold is set at 95%, we can achieve herd immunity by August 24th, 2022. Although currently an estimate, the 95% threshold limit is a goal the country is trying to reach. But in order to reach this aim, the United States population must take action and partake in COVID-19 vaccinations. I want to go over a brief story to mark the importance of vaccines in our everyday lives. So I'll begin with the story. Gigi never worried about receiving a flu shot. Around Thanksgiving, she and her husband, Brian, started to feel poorly and remained sick for weeks. Several visits to the doctor resulted in the diagnosis of influenza, flu. While Brian gradually got better, Gigi's condition worsened dramatically. She was hospitalized and had to be sedated and intubated with machines helping her breathe. Brian and her children were devastated by Gigi's condition. Fortunately, she eventually improved. Although Gigi was able to get back home to her husband and children, her experience left her with permanent effects. Gigi and Brian now encourage everyone they know to get a flu shot every year to prevent illness that may result in even worse outcomes. Gigi and her family recently took the COVID-19 vaccine to protect themselves and surrounding others from the devastating disease. So to go over what a vaccine is and how it works, vaccines help develop immunity by imitating an infection. The infection almost never causes the illness, but it does cause the immune system to produce T lymphocytes and antibodies. Once vaccinated, the body is left with a supply of memory T lymphocytes and B lymphocytes that will remember how to fight the virus in the future. It typically takes a few weeks after vaccination for the body to produce T lymphocytes and B lymphocytes. The memory cells are activated if the body encounters the same virus again, and once the antigens are detected, B lymphocytes produce antibodies to attack them. To go over the origin of vaccines, the first vaccine ever produced was the smallpox vaccine, in which the cowpox virus was manipulated to create immunity against the smallpox virus. Because of the vaccinations that occurred during its initial introduction in 1796, herd immunity was achieved against the smallpox virus and essentially eliminated the disease. For how a vaccine is given, there are several administration instructions in which they can be given. There is intramuscular, subcutaneous, intradermal, oral, and intranasal. The COVID-19 vaccine specifically is an intramuscular vaccine. And the reason for this is that muscles have good vascularity and it allows the injected drug to reach systemic circulation in a quick manner. This table showcases some of the most common vaccines available currently and the associated administration instructions. Immunization for certain diseases such as hepatitis B, diphtheria, HIV, polio, and so on are given early in an infant. However, other vaccines such as Japanese encephalitis or smallpox are not necessary due to the very low prevalence of the disease. And this is respective to the occupation and location of the person. And of course, the COVID-19 vaccine is the latest vaccine to be introduced for public use. The seasonal flu or seasonal influenza or the flu is a respiratory illness that is quite contagious and is caused by a variety of influenza viruses. The symptoms that are accompanied are fever, chills, cough, sore throat, runny or stuffy nose, muscle or body aches, and headaches. Approximately 8% of the US population becomes from the sick every flu season, and this season is from the fall to the winter. And if a person has a previous history of comorbidities or chronic conditions, further complications such as pneumonia, myocarditis, sepsis, and neurological conditions can arise. And one marked emphasis for the influenza virus is that it can undergo mutations in which the genetic makeup of the virus changes over time, making it harder for the body to detect it and to prevent illnesses from occurring. The benefits of flu vaccination is that it reduces the risk of visiting the doctor by 40 to 60%. It also helps protect groups of people that have chronic health conditions or comorbidities, as well as pregnant women. And this can be done during or after pregnancy. And overall, the flu vaccines dramatically lowers the risk of spreading the influenza virus and helps protect people around you. Initially considered as pathogens that cause mild illnesses, coronaviruses weren't generally thought of as too dangerous of a disease. However, in 2002, the severe acute respiratory syndrome, or SARS-CoV, emerged, and this can cause an illness that can progress to pneumonia and respiratory failure. The Middle East Respiratory Syndrome coronavirus, MERS-CoV, was introduced in 2012, and it was even more lethal than SARS-CoV. However, thankfully, it was less transmissible than the other coronaviruses. And now, obviously, the one that's currently causing the pandemic today is severe acute respiratory syndrome 2, or SARS-CoV-2, and it spread from its initial origin in Wuhan, China, and resulted in the current global pandemic. This table over here, it illustrates the devastating impact that COVID-19 has had. And it shows the number of cases and deaths from COVID-19 from February 1st, 2020 till July 1st, 2021. And overall, there have been over 178 million cases and almost 4 million deaths worldwide. Although this climb in the number of cases and deaths has declined over time, it's still increasing at a substantial rate. So there can be two cases of COVID-19 in which the symptoms present as mild or severe. For 81% of the cases, it's considered mild, in which the symptoms are a low-grade fever, dry cough, fatigue, headache, new loss of taste and smell, GI distress, itchy and painful patches on the skin, as well as diarrhea. However, for the more severe cases, which accounts for 14% of all cases, the symptoms that are accompanied are shortness of breath, chest discomfort, confusion or responsiveness, difficulty staying awake, watery eyes, swollen eyelids, and a blue face, which indicates a lack of oxygen. To go over more about the specific features of the COVID-19 virus, there are variants that have emerged over time. And as seen in the table, the relative variants are given code names of alpha, beta, gamma, epsilon, and delta for some of the most prominent ones. And these variants arise from spike protein substitutions in which the amino acid sequence of the genetic makeup has been altered through some form of mutation. And one variant that's been extremely devastating and is causing lockdowns and mask mandates to come back again is the Delta variant. And the relative proportion of this variant in the United States currently is 83.2%, where about a month and a half ago, this number was only around 8%. And with this variant comes more transmissibility, and it's more elusive to the immune system. So people that may have been vaccinated or are not vaccinated are much more likely to show relative symptoms from this variant. For medical treatment for severe COVID-19 cases, there is the monoclonal antibody treatment, and that has been shown to reduce symptoms of COVID-19, particularly for immunocompromised patients. And this is the latest method of treatment that's been shown to have great results. So that's a very promising aspect. Remdesivir reduces the recovery time of COVID-19. Dexamethasone reduces the death rate for hospitalized patients. Although it has results that are still uncertain, convalescent plasma treatment is believed to prevent adverse outcomes from COVID-19. So for prior research that we built off is the effects of comorbidities and infection from COVID-19. Previous research has investigated that chronic conditions using systemic reviews showed that factors such as cancer, renal system diseases, and cardiovascular disease, among other prominent conditions, have caused an increase in severity from the disease and higher mortality rates. And highlighted from the findings has been shown to investigate the mechanisms between the pre-existing condition and the COVID-19 outcome. COVID-19 has also devastated communities that experience low income and that are underprivileged. Factors such as occupational exposure, restricted quarantine measures, less access to healthcare, and comorbidities all collectively have led to underserved communities being more affected by the effects of COVID-19 through increased deaths and severe diseases. And in association with underserved communities, health disparities and social inequities place racial and ethnic groups at higher risks for worse outcomes from COVID-19. So the socioeconomic status, ethnicity, deprived locations, those are all significant determinants in receiving equal health care. Yet discrimination, job differences, low wage positions, and limited education all collectively contribute to the large difference seen in how COVID-19 impacts disadvantaged individuals more significantly than people who are more privileged. So more towards the focus of what this training program is focused on is the community engagement. So this is defined as a factor to maintain primary healthcare and promote people-centered services. So this can involve participation of individuals, groups, and structures for decision-making, authority, and delivery services. So essentially, by promoting this community engagement program, the COVID-19 pandemic will experience better prevention control measures through increased awareness and better understanding of what's currently occurring. So for who is receiving the COVID-19 vaccine, the recommendations from the CDC and ACIP health organizations divided the allocation plan as 2 phases. From phase 1A, 1B, 1C as the initial phases of the healthcare personnel, long-term care facility residents, as those were the first individuals to receive the COVID-19 vaccine, followed by frontline essential workers and people aged 75 years or older. Afterwards, people aged 65 to 74 years and 16 to 64 years with underlying medical conditions were considered. And then finally, we're at the phase of the age-based groups, in which the vaccines have been shown to be safe for people aged 12 years or older. So this map illustrates the percentage of total population vaccinated for each relative state. And it can be seen that the West Coast and Northeastern states are doing much more well due to the percentage of the fully vaccinated population. However, the middle of the country and 2 states of Mississippi and Alabama that have the worst or lowest percentage of their population vaccinated really emphasizes that the distribution of the vaccine isn't occurring as we hoped, and that there's still a lot more work to be done. And as you can see in this table, each and every state is illustrated here, in which the percentage of population that has received 1 dose is going from an increased number to a decreased number. So you can see Vermont is the highest percentage of the population that has received 1 dose, and that continues on, and then this goes more and more down. So you can see that a lot more countries or states that are inside the middle of the country are have a lot lower percentage of the population has received 1 dose. So for vaccine safety, the main priority is to ensure the best safety possible. And this relies on extensive research by the scientists and specialists and is done through 2 methods of clinical trials and post-licensure safety studies. So to go into more depth about what these processes are. So clinical trials are focused more towards the before releasing the vaccine, in which the FDA gathers testing information to determine if the vaccine is safe. So this includes the phase 1, 2, and 3 clinical trials that begins on animal testing and later on to humans. And then afterwards, once the vaccine has been released, post-licensure safety studies are performed for continuous monitoring of the vaccine. And this confirms its safety to see if any adverse effects have come about, or if anything should be considered regarding the vaccine. So the 3 emergency use authorized COVID-19 vaccines that are being used in the United States today are Moderna, Pfizer, BioNTech, and the Johnson & Johnson vaccine. So Moderna and the Pfizer vaccines are quite similar in that they're both mRNA-based vaccines and require 2 shots apart, and they have a relatively high vaccine efficacy rate of around 95%. The Johnson & Johnson vaccine is a more conventional type of vaccine as an adenovirus viral vector vaccine that requires only 1 shot and has a 66% efficacy rate. So to give a little background of the differences between the mRNA vaccines and the current vaccines, RNA is produced from DNA in lab testing. And more importantly, the virus is not used to create the vaccine, only the gene sequencing is used. So the RNA creates the antigens and enters the immune system, and then this will help create the antibodies. And additionally, they can have a standardized production process for mRNA vaccines so that the research and development money doesn't have to be extremely substantial to keep this production process going. And it has a lot more flexibility in which the type of pathogen it can target. Compared to more conventional vaccines, cell cultures are required to create the vaccine, and viruses are also necessary. And then the virus antigen causes the immune system to create the antibodies rather than the RNA. And then additionally, each vaccine requires its own production process. So it'll be much more expensive to use the conventional type of vaccine production process. 2 upcoming vaccines that are coming out in the near future are the Novavax and AstraZeneca. Novavax requires 2 shots, as does AstraZeneca, and it has a relatively high efficacy rate, especially against a variant strain of the B.1.1.7 that's in the UK. And the AstraZeneca vaccine is currently being used in Europe, however, is still waiting for FDA approval in the United States. However, those are not the only vaccines. Obviously, there are a lot more that are being used in different countries across the globe. And just to give you an overview of the most prominent vaccines that are being used of Moderna, Pfizer, Johnson & Johnson, AstraZeneca, as well as Sputnik 5, which is initially produced by Russia. And this table just gives you a nice overview of the effectiveness and the relative doses. To go over social justice, which is a very important aspect of distributing the COVID-19 vaccines, it's an issue that's not only in this country, but in globally, so that higher income populations are receiving the vaccine a lot faster than poorer regions. And this can be seen by the relative figure on the right. So the United Kingdom, Germany, United States have very high percentages of their population vaccinated in comparison to different countries such as Mexico. The world, as you can see, is around 25% vaccinated, and India and Syria, which are very, very low in terms of the relative population that have been vaccinated. So in order to achieve the herd immunity, the social justice must be achieved for all. And there must be better distribution plans and better equity. And Dr. Jerry Abraham of the Kendrick Community Health Center is doing just this in creating the equitable vaccine distribution for numerous minorities. So Blacks and Latinos who are eligible for the COVID-19 vaccine, they usually face a lot of racial discrimination, transport barriers, and access issues for the COVID-19 vaccine. However, Dr. Abraham has been able to provide more easy access for people in need of vaccination. And through its resources and volunteers, over 2,000 people a day are receiving the vaccine at Kendron Community Health Center. And people who are eligible, such as seniors, are able to walk in and register without an appointment. So for future considerations and takeaways from the pandemic and for vaccinations, it's crucial for the United States to go over its response plan to become better reworked and better established. And this can involve more rapid responses to perform critical actions, more effective mandates for quarantining, social distancing, and lockdowns. Furthermore, better experience for biotechnology companies to generate new vaccines, particularly for the mRNA vaccines, in which Moderna has been suggesting that they will be focusing on HIV and cancer treatment through their mRNA vaccines. So that's a really, really great thing that's going to come out in the future, hopefully. Furthermore, more funds for pharmaceutical and medical R&D can improve the healthcare responses and lead to better preventive measures. And finally, a global effort for analyzing the SARS-CoV-2 virus has led to better genome mapping, so that when we create vaccines for the future, we know exactly where to look at and how to analyze the virus, so that we can produce a vaccine that is safe, effective, and in a very fast time. And yes, so once this presentation is now finished, so once you have completed your survey, you'll receive a certificate of participation, in which your name will be included, and it will be emailed to you. And to go over our research team, thank you to Dr. McGee for being the principal investigator and vaccine research advisor. Thank you to Dr. Oliver Brooks and Dr. Jerry Abraham for the vaccine physician advisor and vaccine safety physician advisor. Leslie Duru as the undergraduate student e-scholar, Aiden and Julian Handler for the e-scholar research and Harvard Spark Scholars, Matin Sadeghi as the e-scholar and graduate student in global medicine, Dr. Thomas McGee for scientific communication and academic senate president, for the community programs of Lauren Espy, and for marketing communications of Eileen Kwan and Sandy Brambilla. Okay, so you can continue with the survey questions. I'll provide a link. If anyone has a question, you're welcome to ask me. So thank you very much. And it's much appreciated. Thank you.